Hi, my name is Sage, and for my 6th and final sports medicine project, I did a post-surgical rehab and I compared the meniscectomy and the meniscus repair rehabs and surgeries. What is a meniscectomy? A meniscectomy is when parts of the meniscus are deemed unsalvageable from an injury and the damaged area is cut out. Reasons for a meniscectomy may be when there is a tear in the white zone or the inner zone of the meniscus. As you can see on the right image here, the white zone is the inner 2/3 of the meniscus. This area is non-healing due to little blood supply, and this part of the meniscus is what will be removed during surgery, if not all of the meniscus. Because part of the meniscus is taken out, there is a loss of joint space, as you can see on the picture on the right, which can lead to further degeneration of the knee and a higher chance of developing osteoarthritis. This means that a total knee arthroplasty may be more likely in the future. A meniscus repair is when parts of the meniscus are sewn up to heal, as many other injuries are. The reasons for a meniscus repair is when there's a tear in the red zone or the outer zone of the meniscus. The outer, as you can see on the picture on the right, it's the outer 1/3. And it's called the red zone because it gets blood supply, so it will heal. So this area is usually healed after being sewn up. This is what an athletic rehab program for a partial meniscectomy might look like. Phase 1 will mainly consist of range of motion, and it'll be 1 to 3 days post-operation. The goals of phase 1 are to control post-operative swelling, ambulation or simply walking on stable and level surfaces with weight bearing is tolerated, passive full extension and active flexion to 90 degrees by week 1 to restore patella mobility and to keep pain level minimal with active daily life activities. Some exercise to meet these goals are ankle pumps as seen here, single leg raises as seen on the previous slide, and quad sets, which will be seen on the coming slide. Since not all rehab programs are time-based, they're actually based on criteria. The criteria to progress from phase 1 is a normal gait and minimal effusion or swelling within the knee joint. Phase 2 consists of strengthening and can happen 3 to 14 days post-operation. The goals of this program consist of preventing knee stiffness through range of motion program, full weight bearing while stressing proper gait mechanics, independent single leg raise with 0 degrees extension lag, so the leg is completely straight, remove sutures between days 7 to 10 if necessary, and to teach the patient about the maintenance of their injury, for example, telling them that they have to lay on their leg specifically, etc. Some exercises to meet these goals are stationary bike as seen here, a mini squat as seen on the previous slide, and a wall sit, which will be seen on the next slide. The criteria to advance to the next phase is when there is a good amount of pain control and the athlete is no longer in excruciating pain. There's no more post-operative effusion. They have complete full extension compared to the other non-injured side, and passive range of motion 0 to 120 degrees, and they have a normal gait on all surfaces as well as single leg balance greater than 15 seconds. Phase 3 is proprioception and happens 2 to 4 weeks post-operation. The goals of proprioception are to maintain a range of motion symmetrical to the unaffected leg, normal stair ambulation without pain, and to improve strength and confidence in the athlete. Some exercises to meet these goals are progressive step-ups as seen on the previous slide, heel raises as seen on this slide, and clamshells, which will be seen on the next slide. The criteria to progress is range of motion almost symmetrical to the uninjured and opposite leg, and strength within 80% of the uninjured leg. Phase 4 is going to be plyometrics, which occurs 4 or more weeks post-operation. The goals of this phase are to progress to full range of motion, to improve muscular strength and endurance, to control the forces as the extensor mechanism, to normalize single leg balance with proper proximal control, so no valgus or hip medial rotation, Minimal swelling and almost no pain with return to daily activities, including work. Some exercises to help meet these goals are squats or lunge progressions, which can be seen on the previous slide as in a single leg squat instead of a double leg squat, higher step-ups as seen on this slide, and lateral walks that are going to be seen on the next slide. The criteria to progress to the next phase is strength within 80% of the unaffected side and a single leg squat test by 90 seconds, which demonstrates proper form. Phase 5 is functional/sport specific and is done 5 to 6+ weeks post-operation. The suggested criteria for an athlete to be done with this rehab program, although they should continue to do these exercises for much longer than this because their legs will be unbalanced for a long time, should be limb similarity index of 90% or greater on functional hop tests, no pain or complaints of instability with functional progression of sport-specific outcomes, of sport-specific skills, and greater than 90% on outcomes. Some exercises that can help with this are both legs to single leg jumping on a level ground, box jumps, then down, lateral hopping, dynamic control with advanced balance exercises.